women colleagues who are fighting at the front lines. They have been working in those most difficult positions in this battlefield without fire and smoke. They are the roses on the battlefield and the heroes in arms way, the angels without wings. Today, we will focus on the topic of care, love, and support given to the medical workers. We have with us DDG Duan Yong from the Human Resources Department of National Health Commission, Inspector He Qinghua from the Disease Control Bureau of National Health Commission, Inspector Guo Yanhong from the Medical Administration and Hospital Management of National Health Commission, Director Liu Yamei from the Publicity Department, and Deputy Director Li Yueyang from the Rights and Interest Department of All China Women's Federation to take questions. We also have with us Director Physician Zhao Yangyu from the Obstetric Department of the No. 3 Hospital affiliated to Peking University to give us health knowledge. Updates on epidemic in the 24 hours on the 7th of March, according to data from provinces and the Xinjiang Production Construction Corp. New confirmed cases 44, new deaths 27, all from Hubei. New suspected cases 84. Newly cured and discharged from hospitals 1,661. Those of medical observation 4,021. Severe cases were reduced by 225. As of 24 o'clock of the 7th of March, according to data from provinces and Xinjiang Production Construction Corp, remaining confirmed cases 20,533, including 5,264 severe cases. Cumulatively cured and discharged from hospitals 57,065, cumulative deaths 3,097, cumulatively reported confirmed cases 80,695, remaining suspected cases 458, cumulatively traced close contacts 674,038. Those that are still under medical observation 23,074 in Hubei province. New confirmed cases 41, all in Wuhan. Newly cured cases 1,543, including 1,259 in Wuhan. New deaths 27, including 21 in Wuhan. Remaining confirmed cases 19,710, including 17,772 in Wuhan. Severe cases 5,140, including 4,850 in Wuhan. Cumulatively cured and discharged from hospitals 45,011, including 29,770 in Wuhan. Cumulative deaths 2,986, including 2,370 in Wuhan. Cumulatively confirmed cases 67,707, including 49,912 in Wuhan. New suspected cases in the province 42, all in Wuhan. Remaining suspected cases 295, including 258 in Wuhan. In the 24 hours of the 7th of March, newly reported, imported, confirmed cases 3, including 2 in Beijing and 1 in Gansu. As of 24 o'clock of the 7th of March, cumulatively reported, imported, confirmed cases 63. And from Hong Kong, Macau, and Taiwan, cumulatively reported confirmed cases 164, including 109 in Hong Kong, 10 in Macau, and 45 in the Taiwan region. Apart from Hubei province, the newly confirmed cases 3, all from imported cases. For the first time, we do not see new domestic case. New suspected cases 42, no deaths. In other provinces, severe cases were reduced by 6. In Hubei province, apart from Wuhan, For 3 consecutive days, there were no new confirmed cases, and in Wuhan, on the day, the new confirmed cases were reduced to below 50, and all these has shown the effectiveness of our prevention and control, and we see a positive direction. With the international epidemic unfolding, we've seen great risks and pressure from imported cases. Now we'd like to take questions. Please ask your questions around today's theme, and please identify yourself before you address your question. First question. Journalist from the first row on the left side. Thank you. From the new media of CCTV, the general public is interested to know the implementation of President Xi's suggestions on providing care and love to those who are working at the forefront. What are the implementation of these supportive measures? I'd like to ask Mr. Duan Yong from NHC to take the question. Since the outbreak of the epidemic, medical staff have been working around the clock at the front line. They contributed to the safeguarding of people's lives and safety. President Xi has given important suggestions and emphasizing the medical staff are the backbone of this fight. We must provide love, care, and support to medical staff. The Epidemic Response Leadership Group has circulated notice to safeguard the compensation packages to work-related injury, salary packages, psychological counseling, and humanitarian care to the medical staff. Altogether, 10 measures were adopted, and localities have responded actively in implementing the 10 suggested measures. For example, the rotation of the work so that medical workers can have sufficient break and rest, and medical supplies insurance. This is also one of the items of the inspection from the central officials. Up till now, 20+ provinces have adopted specific measures to implement the suggestions from the central government and leadership group. And for the next steps, we will continue to promote localities to implement well those suggestions. Meanwhile, we will also promote localities to establish long-term mechanism to provide love, care, and support to the medical staff. Thank you. Next question, please. Journalist from the first row on the right side. Thank you. With Xinhua News Agency. During the prevention and control of the epidemic, epidemiological survey has become a hit word among the general public. So I'd like to ask about the role played by the epidemiological surveyors. I'd like to ask Inspector He Qinghua to take the question.
Thank you for your care for the epidemiological surveys. As an important component of the medical professionals, the disease control workers are one of the key players in disease prevention and control. They have played a crucial role. The disease control staff are working at the front line, and they have made a lot of substantial work. Just now you asked about epidemiological survey. Well, we have epidemiological survey staff or epidemiologists who have to conduct face-to-face studies on the contacts and on the targets. They need to learn from these subjects or targets their whereabouts, their contacts, and etc. And if there is a cluster of cases, then our epidemiological staff need to visit the patients' households or families and trace all the contacts and quarantine them for 14 days. By yesterday, March the 7th, for traced close contacts nationally, the total number has exceeded 670,000. The best way to prevent the potential spread of the epidemic is to quarantine them. Also, apart from directly facing the patients, like the epidemiological staff have done, we also have the laboratory technicians or the testing technicians. For every sample we receive, it could be containing the active virus. However, the technicians are brave and use their professionalism to fight against the virus. They seek every opportunity to test the samples, and recently, epidemic has occurred in almost everywhere, and then it is necessary to disinfect these locations following the standard procedure and creating a clean and safe environment for people to work and live. Also, we have a psychological support team. They are working around the clock to provide psychological counseling or support to the general public. It is fair to say that they have been working silently, yet they have safeguarded people's health. They are the heroes in the new age, and I sincerely hope the general public and the media can show more care for these disease control people. Okay, let's continue. On the right, on the second row, the third reporter, please. Thank you. I'm from Hong Kong Economic Herald. Recently, I would like to know how many doctors and nurses have been to Wuhan to offer help, and what is the percentage of the female people? Okay, thank you for your question. Since the epidemic, the health system, in particular the medical professionals, are brave and making every effort to rescue life and safeguard people's health. On the eve of the Lunar New Year, the first team of medical assistance has arrived at Hubei. Now we have over 36 medical teams working in Wuhan, helping the city and the province to increase the cure rate and reduce the mortality rate. For the medical teams, I think there are three features. The first one is of large scale and strong capacity. Up to now, the medical teams have been dispatched to Wuhan, and the total number reached 42,000. For intensive care staff, they number 19,000. Also, we have respiratory infection, cardiovascular, and etc. Professionals. Also, we have sent a very strong team. For example, the teams are composing the academicians and the leading experts in the relevant fields. They have played important roles as technical experts offering guidance. The second feature is of the good efficacy and the immediate response. Usually, it only takes less than 2 hours to set up a medical team, and from establishment to the dispatchment or to the arrival, usually within 24 hours. And also with the expansion of the makeshift hospitals, from the delivery of the hospital to the medical supply preparation, running in parallel, we are dispatching the medical teams. So once the makeshift hospital is ready, the staffing is also ready. Also, in renovating the ICU wards and coordinating the supplies, we are also setting up the dedicated medical teams. So these three things are working in parallel, and this has maximized the efficiency. The third feature is we have the teamwork in operation. So from the ministerial level and the provincial level general hospitals, they have set up medical teams which can take over the makeshift hospitals. This has increased the medical quality and brought into full play the role of the teams. Among the medical staff, we have female medical professionals representing 2/3 of the total. It is fair to say that the female professionals are playing the same important role in the epidemic control, in particular represented by academician Qiao Jie and academician Li Lanjuan. The female medical professionals have great expertise while also demonstrating their sacrifice and dedication to the medical practices. They are the most adorable people of the age. Let's continue. We will have the second reporter on the second row on the left, please. Thank you. I'm from Chinese Women News. I have a question for ACWF experts. Today is the Women's Day, and as the epidemic happening this year, it is quite unique. I would like to know if there's any special arrangement for this year's Women's Day. We will have Madam Liu to answer the question. Thank you. Just as you have said, today is the International Women's Day, but this year's Women's Day is particularly important because in the context of the epidemic, we are working closely. This morning, President Xi Jinping sent his greetings to the female who are working in the front line, and also he sent his festival greetings to all the women in China.
Recognizing their great contribution in the prevention and control against the epidemic, expectation is laid on their shoulders. Just as journalists have commented, today is International Women's Day, but right at this moment as we are speaking, many of them are still saving the lives. Some are engaged in the resumption of business operations, and some are busy inspecting in communities. For all the women who are engaged in the frontline work and who are still working today, we'd like to salute you. You have been working really hard, and you deserve our special thanks. All China Women's Federation has initiated an advocacy to all the Chinese women. We try to be the best, perform the best on our posts, contribute to families and to the country. This might be the best implementation of the suggestions from the president and the central government. Next question, please, journalist from the fifth row on the left side. Thank you. With Changjiang Daily. Schools are still closed. Many children are staying home, and their parents, in particular mothers, are anxious, especially the mothers who are away from children and working at the forefront. So what is the psychological support to mothers? I'd like to ask Madam Li Keqiang to take the question. Thank you for your question. After the outbreak of the epidemic, women tend to have anxiety and fear. The female medical workers and the community workers who are working at the front line because of the strong work stress, they do need psychological counseling and support. That's why All China Women's Federation, apart from the 12338 hotline, we set up a new psychological counseling service in those who man this hotline. We've asked the psychological counselors to man the hotline. In some localities, China Women's Federation have also invited psychological experts to go to communities and provide some interventions. After we manned this hotline for a while, we've found 53 frequently asked questions, and we compiled an electronic book on the psychological support provided to women, children, medical staff, and we've distributed this booklet to the 12338 hotline takers. And many of the questions and answers are targeting at the medical staff. Next question, please. Thank you. And Economic News Daily. Reports have it that some hospital heads protest against support provided to Hubei. Premier Li Keqiang has emphasized it is important to implement the supportive measures, the temporary work subsidies, and medical prevention control subsidies. The diagnosis contact the medical staff who have been contacting the patients, and in particular those in the ICU zones and the quarantine zones, the subsidies must be implemented. So how can we ensure that those working at the front lines can indeed get this subsidy? I'd like to ask DDG Duan Yong to take the question. Yes, in Shanxi province, one hospital has distributed the subsidy to its own staff, and the president of the hospital refused to give the subsidy channel, the subsidy, and transfer the subsidy to Wuhan. Shanxi province acted immediately and punished those who have violated the regulation. To avoid the repeating of a similar event and to provide convenience and facilitation to different hospitals and localities to implement the policies, we have collaborated with Ministry of Human Resources and the Ministry of Finance. On top of the fourth degree, we've improved the relevant financial regulations. First, we've further defined clearly those who are working at the front lines. It depends on whether there is direct contact with suspected or confirmed cases. The temporary work subsidy should be distributed and earmarked for these medical staff. The temporary work subsidy is categorized based on the risk exposure of the medical workers. There are 2 levels of subsidies. Second, we will review and follow closely the implementation of the policies. We will implement the procedures for registration, review, and approval. For the falsified collection of the subsidies, those will be punished. It won't go without impunity. We will follow the guidelines from the State Council and the Central Party Committee to provide real benefits to those who are really working at the front line. Thank you. Next question, please. Journalist from the 4th row on the right side, please. Thank you. With the cover news, you've said that more than 40,000 medical staff have been to Hubei province. So how can they rest in rotations? They may be in Hubei for more than a month. When can they go back to their original workplaces? I'd like to ask Inspector Guo Yanhong to take the question. Thank you for your question. Yes, indeed. Those medical workers have been working at the front line around the clock. They are under very intensive workload, and they are exposed to a high risk of infection. We have made an array of arrangements for taking breaks. Rotation in breaks are arranged in the following ways. First, medical team will rotate so that the entire medical team can have rest. 56 medical teams in Wuhan and 2 medical teams in Huanggang have enjoyed this whole team break. Second, for those who are providing treatment to the severe cases to ensure the coherence of treatment, it is not convenient for them to have the entire team off. Therefore, we have increased the hands and the staff. We've sent more medical teams so that they can collaborate in a new team, and so that the breaks can be extended and each duty can be of shorter hours, so that each one in the team can have sufficient time to take a break. Third, we've also adapted flexible scheduling in a contextualized manner to extend the length of break so that the team members can be energetic in their work and can rest well. And in light of the high risk of infection, we've also made a lot of efforts. In Wuhan, there is one specialized team on infection control and prevention, and this expert team focuses on providing infection prevention control and safeguarding training to medical teams before they are involved in the treatment, so that they can better protect themselves and minimize the risk of infection. Up till now, among the 42,000 medical team members, there is no one infected. In light of the psychological stress, we've sent a psychological support team of more than 300 staff.
This psychological support team helps not only the general public and the patients, but also the medical professionals working there. As for the adjustment to the medical workforce, I think it is fair to say that at the moment the priority and the pressing task remains to save the lives and to increase the cure rate. So the medical teams are encouraged to continue their efforts to provide the treatment, appropriate treatment, and optimized medical care to the patients so that we can maximize the cure rate, save the lives, and bring into full play the medical teams. It is fair to say that they will not leave the front line until the battle is won. I'd like to add that for the frontline staff, for their breaks and quarantines, well, they will be treated as they are on duty, and they will enjoy the normal subsidies and various daily allowances and financial support. Now we will continue. On the right, thank you, with CCTV. The medical professionals are also family members of their families. So for ACWF, what are the care measures in particular to the women medical professionals? We will have Madam Liu to answer the question. Thank you for your question. Indeed, the medical professionals are angels of people's life and safety. They have sacrificed their small families to save the big family of the society. Indeed, it is our due responsibility to help them to protect the families, and ACWF has been motivated to provide relevant support to the medical professionals' families. For example, in some localities, the Women's Federation branches provided vegetable packages or household services to the relevant families. And in some localities, such fresh vegetable package were delivered to the families or households, or some household services to the relevant families. We also pay particular attention to the female medical professionals who are working at the front line. On January the 30th, we have already sent a letter to all the female medical professionals, and we have raised supplies worth 210 million RMB yuan to help the frontline medical professionals. And also we have provided the female supplies like the sanitation and pads to the female doctors and nurses. In some localities, the local Women's Federation has been very considerate in the light of the high humidity in the local area. The local ACWF branch provided the ultraviolet sanitizer to the relevant female medical staff. We are trying our best to provide support to the medical professionals, especially the female ones. Okay, on the left, the reporter in black. Thank you, from Hong Kong China Review. Now, the sectors are resuming work, so what are the dedicated measures for females' resumption of work? Well, for ACWF, we are utilizing our advantage and help the women to get back to work and operation. In ACWF, focusing on agricultural production, we provided about 400 online courses. And then for marketing or the online marketing, we have mobilized the relevant staff to help with marketing online. For example, in Hangzhou, on one of the online platforms, the local ACWF staff help to sell the local delicacies and food. Also for urban residents, especially the female in urban areas, we have set up the online job fair to help the companies to recruit the female workers. And last but not least, we are also mobilizing the production. We have awarded female entrepreneurs whose companies are producing the female-specific products. Okay, let's continue. On the left, on the fourth row, the lady reporter, please. Thank you. From CCTV, the international channel. We know that the medical professionals are under big stress. So what are the psychological support provided to them? Now we will have DG He to answer the question. Thank you for your question. Since the outbreak of the epidemic, the medical professionals are working in the front line of epidemic containment and control. They are under heavy workload and heavy stress, both physically and psychologically. How to help them from the psychological perspective? In NHC, we mainly adopt 4 measures. The first is the psychological intervention in emergency response. The medical professionals have been identified as the priority population group for such psychological interventions. There have been specific requirements for such psychological intervention to be conducted. And second, we have set up dedicated network to offer professional psychological counseling. Up to now, there have already been 613 hotlines set up, and over 100 of them have already been dedicated to the medical professionals. Also, we have relevant platforms providing around-the-clock psychological support. And thirdly, we have made public advocacy with public counts. We have released various advocacy materials to help the medical professionals to get over the psychological stress. Furthermore, we've also sent 415 mental health experts to Wuhan and provide professional technical support or psychological counseling to the medical professionals. For the next step, we will continue to organize such expert support to the medical professionals. Thank you. Let's continue.
Journalist from the second row on the right side. Thank you. With the Dragon Television, in the prevention and control against the epidemic, there are many volunteers who have contributed their efforts, and many are women volunteers. So what are their specific roles? I'd like to ask Madam Liu Yamei from ACWF to take the question. Thank you for your question, and thank you for your interest in knowing the contribution from the female volunteers. In media report, you may have already learned that many female volunteers have been working dedicatedly in one of the communities in Wuhan. And police officer named Shi Xuerong has established a female volunteer team of 16 women for providing services to 147 vulnerable households, sending them medicines, vegetables, fruits, and they've also helped the communities to transfer 67 suspected and confirmed cases. That team was applauded by the community, and it grew bigger and bigger into a team of 66 members. There are many teams like this. They have been working in communities in each unit and knitting the network of mass prevention and control across the country. 24 million registered women volunteers are working. All China Women's Federation pays great attention to the role of these women volunteer team. We hope they can be the mentors, the inspectors, and the advocates of the mass prevention and control, contribute to the safeguarding of communities and homes. And the leadership of party committees, many grassroots level and community level staff have been working with these volunteers. They go to the villages and the streets to have door-to-door visits and to disseminate prevention and control science knowledges. Some volunteers with professional skills have played unique roles. We have an online training program which is welcomed by many parents, and many of the courses were provided by these professional volunteers. They guided parents to guide their children to have a self-study so that the life at home will be colorful. Children will form a good habit of learning and a healthy lifestyle. Thousands and thousands of volunteers' efforts have shown us that the good Chinese tradition of neighborhood community and the love and affection lent to those around us. This is the tradition we want to carry forward to future generations. Thank you. In the interest of time, we can take last two questions. Journalist from the fourth row on the left side. Thank you. With the China Daily, we've noticed that in the prevention and control of the epidemic, many women staff have made great efforts, and there are many touching and impressive stories. Are there any rewards for them to recognize their contribution? Thank you for your question. Madam Liu Yamei is taking the question. I agree with your comment on the value and contribution from the women workers. We have not only considered the rewards, we also consider the rewards should go to anyone, like the epidemiological staff, the medical workers, the police officers, the community volunteers. They are all working loyally at their posts. In particular, the party members have played an essential role. Every day, their stories are galvanizing us to move forward. Madam Xu Hui and altogether 3 martyrs, female martyrs, have been rewarded as the models. And yesterday, we've also launched a list of heroines, including Xia Sisi and 20+ medical workers. We will issue further lists of heroines. We want to reward and give prizes to 300+ medical workers and the workers who are working at other areas. 200+ female organizations will also be awarded. We've collaborated with charities funds to fund those who will win the awards. We will provide subsidies to them. The last question, journalist from the 5th row on the right side. Thank you. My interest is in medical workers, so I'd like to ask Inspector Guo Yanhong to take the question. You've said that the medical workers enjoy rotation of breaks. And there are also medical workers who are still working at the front lines in other provinces. What are the specific measures to ensure they can have a break? Please identify yourself with the CNR of the CCTV group. I'd like to ask Inspector Guo Yanhong to take the question. Thank you for your question. To ensure a good job can be done in supporting and loving our medical workers, we have an array of specific measures. When we organized the medical teams, some members may volunteer to come to help Hubei, but they have their own difficulties at home, and some volunteers and the medical staff are not of a strong physique themselves. They may feel uncomfortable and work stress, and we help them to return homes. And also those who work in ICUs, they will be exposed to high work intensity. So we say that older aged medical staff should not be working in ICUs. 2/3 of the medical workers are female medical workers. So we pursued at our best to care and support them, including providing some supplies and in answering their needs for their special interest. With the support from the local government, we've also provided safe and clean and good accommodation. We provided convenient commuting to the medical workers, so after the work they can go conveniently and safely back to where they live, so that they can have sufficient break and be involved in the medical work with sound energy. Thank you. Now I'd like to ask our expert to give us some health knowledge. I'd like to invite Director Physician Zhao Yangyu from the Obstetric Department of the No. 3 Hospital affiliated to Peking University. Thank you, Moderator. I'd like to answer some of the most frequently asked questions on the health care for maternal women. The first question is, if a pregnant woman is infected with COVID-19, will there be any difference in drug administration? In providing treatment to the maternal women, we need to consider the possible adverse impact on fetus. So there is some slight difference in the maternal women. In the 7th edition of the Diagnostic and Treatment Protocol of the COVID-19, there are some provisions on the treatment provided to maternal women. Women infected with COVID-19 will experience a similar clinical course, but we will consider the stage of the trimester and select medicines that exert the minimum impact on fetus. If the woman is in the later stage of the trimester, we can consider the termination of pregnancy, and a drug will be administered later. For severe patients, we can choose termination by using cessation.
That's the first question. For the second question, that is for breastfeeding moms who have been affected by the epidemic. Can they continue the breastfeeding? Well, according to the available data, the confirmed breastfeeding moms do not find their breast milk tested with virus positive. However, the current number of cases identified is limited, and we cannot be sure if the breast milk contains the virus. Also, during the breastfeeding, there's a risk of contact and infection. Therefore, for pregnant or for the breastfeeding moms who have been confirmed with the epidemic at the moment, we don't suggest breastfeeding. It is also asked if the breast milk can be sucked out, heated, and the virus inactivated, and then used for the newborns. However, such approach may undermine the nutrients in the breast milk, so we suggest to use the formula milk. Since this is just a temporary stop of the breastfeeding, when the lady is cured and discharged, and after the 14 days of quarantine and health monitoring, if there's nothing abnormal, then they can continue the breastfeeding. It is also worth mentioning that it's necessary to take good care of the breast. They can use the breast pump to make sure the breast duct and the galactosis can be avoided. Thank you. Today we focus on the frontline medical professionals and also other professionals. It is fair to say that the CPC Central Committee, the State Council, and the general public are all caring a lot about the professionals. The professionals are dedicating themselves to the epidemic containment. They are the heroes protecting people's health and safety. They are indeed rescuing the patients' lives, and they have also become the heroes and heroines. Up to now, we have already had more than 50,000 patients cured and discharged from the hospitals. So we congratulate them, but we also remember those who have passed away in the epidemic. We'd like to express our condolences and sympathy to their family, to the bereaved families. The spring is coming, and we hope everyone can enjoy the wonderful spring. For tomorrow's press conference, we will focus on the back to work, and we welcome your questions. And that's all for today's press conference. Thank you all.